Other than the budget the Assembly and Senate passed yesterday, this is the best budget that we have seen in years. This version of the budget makes some very strong improvements. More than $14 billion in new funding over last year's budget for our schools and community colleges in one-time and ongoing money. We finally create a state-earned income tax credit. Thank you, Governor. And I want to thank him for picking up this idea and including it in the May revision. This is probably the single biggest new state anti-poverty program created in recent memory. It will make a real difference in the lives of working Californians. We make meaningful improvements to child care and preschool. We increase funding for CSU, expand the number of competitive Cal Grants by almost 15%, and we lower tuition at CSU and UC for middle-income families by 20%. We expand Medi-Cal services to low-income children regardless of immigration status. But this is not a return to the bad old days of spending beyond our means. This budget builds total reserves by over $4.6 billion, and it pays down $1.9 billion in budgetary debt. If revenues grow more in line with the LAO projection than the Department of Finance numbers that this budget is based upon, then reserves will grow even higher. But despite this being such a good budget, we know this is just one step and we have more work to do. We didn't get everything we wanted accomplished in this budget, so we'll redouble our efforts in future budget deliberations. And regarding our governor's call for special sessions, as soon as we wrap up votes on this budget, we will gavel in new extraordinary sessions on infrastructure and health care. Our roads and our infrastructure are falling further and further into disrepair, and that costs Californians time stuck in traffic and money for extra wear and tear and repairs. It's time to end the political sig alert and get moving on the statewide problem. California's done a great job in signing people up for health coverage, but we still face obstacles to Californians actually getting health care because of low Medi-Cal reimbursement rates. The special session allows us to do a thorough examination of this issue instead of trying to triage it through the budget. These two special sessions will allow us to reach timely, bipartisan, and comprehensive solutions to these critical issues. And to Governor Brown and President Pro Tem De Leon, I look forward to working with you to craft solutions that are as solid as this budget agreement that we're announcing today.